This is also again the case of hepatitis in a very small girl of 4 years old, assaulted by more allopathic medicines. Because of that, jaundice happens. This is also old case, 2018. Bhargavi Amol Bakkam, 4 years old female, living in Ghatkapur, Mumbai. What was the chief complaint which she came? She had fever 3-4 days before coming to me with a chill and heat internally, with abdominal colic at umbilical region and right hypochondriac region, with a continued pain aggravated by ET. Back, she has itching since she had illness. Skin eruptions was there on the back. Itching was there few days before. Cough dry, aggravated in morning. Both knee joint pain, dull pain started. Weakness was there, emaciated look with a dull face. Yellowish discoloration was there of whole body, including eyes, sclera. I showed the joint patient like that. Same was there. And she was last 20 days admitted in government Rajawadi Hospital, Ghatkupar, for the same condition. And she was not improving, so they took Dama discharge and came to our clinic at Kolad. This was the chief complaint. This is the report. Her HB was 8.4, WBC count 9,100, platelet 382 lakhs. AGPT, AGVD were very raised, 542 and 1064. Bilirubin was 7.6 total, and indirect and direct was 4 and 3.5, and Australia antigen hepatitis B was negative. This is the report. So they, after this report, they came to the near Mangav area. They came to the child specialist. Let's show her and him. We will can treat also. But they also admitted her for few days. Again, the same situation happens. There was no change. Doctor Yadav, doctor, the name is there of doctor from Mangav. I repeated the investigation again to see what is the current status. AGB was again, AGB again came down 6.7. WC count was 13,900. Bile salt in urine was there, and a platelet count was reducing more and more. I suggested sonography also. In sonography, hepatitis came. No increase in size, only plain hepatitis. Functional changes were there. Structural changes were not present. This is the sonography report. Origin, see how the complaint started. She had infections from eating chicken. Normally in a area, most of the boiler chickens they use. How they develop, they give the injections to the small chicks, and they grow within 45 days or 1 month. The full-fledged hens appear, and they ate the chicken when she came to the Holi area. Holi season was there in our area that time. And after that, the infection started of liver symptoms. And he presented with the yellowish initial skin. They were not noticing why the skin has become yellowish, pale, and weakness started. General symptoms started. Body ache was there, or only weakness after coming from school. Not eating proper well. These vague symptoms were there initially. So they showed in the hospital, do the test, and everything happens. So they showed in Ghatkapur also, in Kasturba hospital also they showed. Then also improvement was not there. They brought a patient to Mangaon for one pediatrician. They also admitted for a few days. Then they told, you go to Mumbai only, we cannot treat. Go to the Wadi hospital in Mumbai, they will treat properly. Otherwise, no one can treat you. Otherwise, she will be very serious because of such a high liver function report. In a past history, she was suffering with the bronchitis, chronic bronchitis. She was having the symptoms. Recurrent coryza or lower chest bronchus wheezing were there. Personal history, reduced hunger. Hunger was reduced, but cannot eat properly. Thirstness was there. Desire spicy, chili foods, chicken. She was desire more chicken. Fast food since 1 year. Aversion to sweets and homemade normal foods. Bowel were regular. Urine was very dark. Bleeding in the urine, orange color urine over there. Sleep, no change. No change in perspiration. Synthesis of the case. See what the symptoms we have considered in the case. Fever she was having in that time, weakness in general, yellowish discoloration of the whole body, abdominal colic at the umbilical region, abdominal colic at the stomach region, right hypochondriac pain, itching on back, cough dry, morning in nausea, aggravated morning with nausea, both knee joint pain was there, appetite reduced, emaciation started and urine dark color. Initially when 2018, I was not having the Zomeo also in any other software. So I had repertorized the case and come to the medicines, and I see the what are the medicines are coming from the approved matter medica, and on that basis I used to practice initially 18 and 17 year, 2017, 18 and 19. Later I purchased Zomeo, and then I started directly from mathematical searching way. These are the psoriatic symptoms of the patient. Pain in the liver region when touching on the right side, full all developed psora symptom over there. Pain in the liver, pressure and tension, a tension below the ribs or the right side, inflammation of the liver, crampy, colic and grasping in the bowel region, very pale white stool, dark yellow urine, brown urine, blackish urine, urine with the bloody particles also sometimes, complete hematuria, cough which does not abate until there is clenching, retching and vomiting, mostly in the morning or in evening, cough worse after awaking in the morning, dry cough because of pressure in the liver and lung symptoms are there, and yellowishness of the skin, yellow spots like nature around eyes and mouth. These are the symptoms. The common group of medicine which was coming, and these are the medicine which is covering bryonia, sulfur, sepia, noxamica, pulsatile and phosphorus. And these are the remedy numbers which is covering the symptoms. Entire loss of appetite, without hunger and appetite, only it's from the habits, while food has it tastes normal. Lack of appetite, she has no relish on anything. Contract to pain in the stomach, all day aggravated after meal. Severe cramps in stomach, dull stretching, dull frequently in the, from the region right side of the stomach. The hepatic region is painful when touched. The liver, spleen swollen, stitching in hepatic region, shooting and stitching in the hypochondriac region. These are the list of the psoriatic symptoms. Tension in the pressure in umbilical region, pale. See how much more symptoms she was suffering with the psoriatic symptoms. Pale color stool, urine scanty, dark brown urine in evening reddish sediments in urine. Dry cough in a day with stitches in the right side of the abdomen with the stuff coryza. Pain in the knee, as if stiffness, tension in the knee itching in the various parts of the body, and internally chill, frequent without thirst. Heat and afternoon intermingle with the chills. Okay. Huh? I will tell this also. I will show the remedy symptoms first. This is a proving number. This is the number, proving number from the remedies. These are the proving symptoms of the medicines. Single remedy. It is only one remedy. We can go directly to that remedy also. I give the answer last also. In page number 120, the psoriatic chronic disease is mentioned in the footnote. If the patient is adulterated or malfunctioned by such an allopathic treatment, start directly with the sulfur. Now this is the one option. And when we see from the symptoms also, then also those symptoms are covering this state. So I gave him sulfur. Sulfur, that time I used to practice with 15 ml water, 30 ml bottle. I was practicing in 30 ml water that time, and I gave the dose that time 2 strokes, 2 drops in 100 ml water, and 2 teaspoon BD for 5 days. When we make the medicine in small bottle, the concentration is very high. And when we medicine in 100 ml water or more water, the medicine concentration is normal. But when we reduce the bottle, the concentration is very high of that medicines. So we that time give the dose 1 stroke, 2 stroke, 3 stroke, like that only in 100 ml water. Otherwise, we have to dilute in second glass or third glass also if the aggravations come by LM potency. Initially we was not knowing why we was using 30 ml bottles. But after later reading the organon again, I find out that we should make the medicine in 100 ml bottles. After follow-up on third day, her yellowish discoloration was reduced, no fever has came back, knee joint pain was reduced and itching on the back also reduced. Appetite was no change, but there was general improvement started. Weakness was better. I continued the sulfur for 1 month. That time the small bottles goes for the 1 or 2 months also. With 0/1 only she got completely recover. On our 12th day, no abdominal colic was there, no itching, appetite has an increase, general weakness became alert and active, weakness reduced, yellowish discoloration reduced and totally gone. And I after 12 days I did his investigation. Previously it was 545 HGOT and HGPT was more than 1000, which became normal below 100 in 12 days, and bilirubin was 7, which came normal, and medicine has acted proper way. This is the report, but HB has not raised at that time also, only it was before it was 6, it became 7 only. Bas. And in that potency only the patient did not came back, but in that potency only the patient completed the dose of whatever the dose I given him, and that only he got recovered. This was only case.
Sir, what's the reference for sulfur for that's remedy for after getting other allopathic medicines?
Chronic disease 120 mg. 120 mg. Footnote this mentioned.
Why are we not continuing this case for improving the hemoglobin percentage? Why are you not continuing this case for improving the hemoglobin percentage?
They never gave the follow-up again.
Oh, they know.
They just call me. She is better, but I needed the follow-up. They were living in Mumbai. From Mumbai to Indapur, it is 4-hour journey, so they don't travel again.
Good condition is whatever they go.
When the jaundice has repaired, they found everything is recovered, then do not give. They were not going.
But we can plan with sulfur next potency.
Next potency.
This also.
Yeah.
Will you continue seeing sulfur if the symptoms are gone? Or will
Yeah, I will continue.
retake the case?
I will continue till 0.3.
Because the symptoms have gone now. So
Then
should we
also
not retake the case? Sir?
hemoglobin should be improved.